Our next presentation is using community-based participatory research to inform policy regarding urban Native American health and nutrition.
Chasiniako ke pasiat, Yepenchinas lemtiquil yathwasket, chiskelu. Good afternoon, everyone. I'm very thankful to be here today. The Séliš refer to themselves as the flesh of the land or the people. Prior to the 1890s, the Bitterroot Séliš people thrived for millennia in Tla'ai, the place of the little bull trout, where many resources were plentiful. In Tla'ai, or present-day Missoula, where 5 valleys meet, includes the Bitterroot Valley. It was an area where surrounding tribes were able to hunt, gather, and trade. My Séliš people were forcibly removed from this area in 1891 by the U.S. Army and crossed the Higgins Avenue Bridge to be placed on what is known today as the Flathead Indian Reservation. Chief R. Lee, my paternal Tupia, and his followers were among the last people to leave. However, we are still here today. The bridge has since been renamed to Bear Tracks Bridge in Missoula and is named after my maternal Tupia. Now, over 80 tribes live in this valley. Many of them are food insecure and in need of nutrition support. Over 1/3 of all Native households in Missoula live below the poverty line. Nearly 2/3 of Native single mothers in Missoula experience poverty. These numbers are reflected in other urban areas across Montana, including our 2 partner sites in Great Falls and Billings. Quotes were a theme yesterday, and Abigail Echo Hawk says, "We are not a historically underserved population. I am colonially underserved." Guided by the urban natives we serve, we took action to collect our own data and sought out trusted partners for help. Mentors, collaborators, and community members met to engage in respectful dialogue, creating groundwork for the project. This project aimed to uncover the relationship between natives living in urban areas and nutrition support programs. We created mentorship opportunities and research methodology to collect our own data. Together, we chose CBPR principles. CBPR seeks to authentically engage community members in research of issues important to them through all phases of the research process. So why did we choose CBPR? Historically, natives have not been treated with transparency or respect by outside researchers. And we know that positive change is more likely when it is indigenous-driven, owned, and includes diverse expertise. CBPR enhances cultural safety and addresses power imbalance. It honors the interests and assets of the community, and it allows for systems-level engagement. So here's how we used it. Project partners co-designed the project and wrote the proposal with guidance from Native community members. All partners were invited to participate in each stage of the research process and trainings. We implemented inclusive authorship protocol for all products, and we co-designed MOUs for project transparency. So this is a piece of our project toolkit. We developed pre and post toolkits for all partners to keep detailing the process and results and as reference for future projects. The pre-toolkit was provided at the start of the project, detailing the purpose, timeline, IRBs, and methods, and the post toolkit will be available upon completion of the project. It's really that simple, folks. No, I'm kidding. It's been an awesome, intensive process, and we're in year 8 of a project that was slated to be 2 years. Oh, I'm seeing 15 now, sorry. A 50-item online survey was distributed with a goal of 200 respondents, and pen and paper surveys were sent to each site as well. It included questions about the use of nutrition support programs, health status, and food security. We piloted the survey with community members before launch, and we used 177 surveys in the final analysis. Recruitment targeted Native families living in 3 urban areas with at least 1 child ages 0 through 8 in the household through flyers, community gatherings, word of mouth, and online platforms. And all participants who completed the survey received a $20 gift card to a local grocery store. 84% of SNAP participants rated SNAP as very easy or easy to use, and 93% of WIC participants rated WIC as either very easy or easy to access. And over half of both SNAP and WIC participants said that both nutrition support programs help them eat healthier than they normally would. Respondents indicating that SNAP success is very easy tended to have better general health scores, and physical function, social function, and mental health scores tended to be better for food secure participants. My project partner Kim and I conducted 23 semi-structured interviews using similar recruitment methods as the surveys. The interviews helped us take a deeper dive on the experiences urban natives face with these programs, including things that enhance participation and things that were barriers. As for barriers, we noticed that nutrition support staff lacked understanding of hunger and food insecurity, discrimination and poverty stigma, underrepresentation of Native staff in nutrition support program offices, and difficulty using the program application, EBT, or website. Sometimes it's a little overwhelming trying to access all the necessary documentation that you need, financial information and work status, and then doing a 45-minute phone interview. It's a slightly cumbersome process. This is a quote that gives you insight on how staff shortage for nutrition support programs and lack of soft skills became frustrating and deterred Native participants. Here's a list of some enhancers: nutrition and gardening education provided, ability to purchase more fruits and vegetables, and ability to use benefits at farmers markets and large grocery stores. I think that it would be to have somebody in the department that identifies with the Native American community would be huge, because then they, would feel more comfortable communicating things more, like applying. This is another quote from an interview participant expressing specific changes, and it's incredibly important to have, Native representation in these fields. So part of our research helps to inform nutrition support programs, community members, and policymakers of barriers and enhancers Natives experience. Currently, we are working to share our results with people like you, tribal leaders, advocacy organizations, and more to positively affect policy change and get food into Native households. I've got a lot of people to thank, but for now, I just want to shout out our team over here. You guys want to raise your hand really quick? And our funders as well. You can find our poster, number 9, next door, and our contact information is listed in the directory. Hi, y'all. Lem Lem Specia.